Thank you for coming. So let me just give you a little bit of background on myself and how I approach serious games. I am a psychologist by training. I have my PhD in psychology. I have my master's in counseling and consulting psychology. And I'm very interested in how games change behavior. So I look at it from that point. Okay. Technology. Okay, so I'm sure all of you know this, but I just want to talk about how games are fitting in with the current healthcare challenges, where we're going from an acute care model, which the hospitals were always good at in the past, which is if you get sick, you go into the hospital, right? You break a bone, whatever, and they take care of you in the hospital, and they monitor you in the hospital. They give you your medications. You don't have to, they control your diet in the hospital. You don't have to remember what medications to take, when to take them, how much. You don't have to manage your diet. It's all taken care of for you in the hospital. And the system is very good at that. But now, because of the great advances in medicine and because all the doctors were interested in increasing the survival curve, and there's all this money put into how can we make people live longer, now everyone's living longer, and we get what we paid for. So we have an aging population, very few kids to take care of the aging population who are living with chronic illnesses and dying of chronic illnesses in a large proportion. And when you have a chronic illness, you don't stay in the hospital. The doctor says, take this insulin shot at this time or take this pill at this time, exercise more, change your diet, come back to see me. Okay, and you're supposed to do that on your own. And they think, well, I give you information and you do it. So we'll be talking a little bit about what's flawed in this model. So then we have these behavioral challenges today. And pharmaceuticals have made big advances. So it used to be people would have to get shots, they'd have to get their medication through intravenously, and people would say, like, I wish I could just get a pill for that. And so they developed these pills. So now there are oral chemotherapy pills. So you no longer have to go to the hospital and sit in a bed and monitor how you're doing when you're taking chemotherapy. You just go to the pharmacy, get your pills, go home, and take your oral chemotherapy by yourself. And people forget to do them. So can I just take a quick survey? How many people are you out here are clinicians, take care of patients? One. Oh, okay. Is it mostly how many people are in technology, computer science? Okay.
Well, that has to say I'm a clinical scientist, so I do a bit of it.
Do applied stuff. Okay, and who didn't raise their hand and where are you from? Yeah.
I'm a PhD student at Coventry University.
In?
I'm doing one of the talks actually in a bit.
Oh, okay. So I'll find out about you later. Okay. Did anyone else not raise their hand? What are you in?
I'm just in film. So.
Oh, you are? Okay. She does videography, which we use a lot in serious games. Okay. So I'll know how to kind of frame what I'm saying. Yeah. And we can all, so now people aren't taking their medications when they're supposed to. And I'll talk a little bit later about how we also develop these technologies that are supposed to make life easier and people don't use them. I'll touch on that a bit. And so with the aging population, what healthcare is trying to do is also increase their focus on preventive healthcare. So to try to keep you from getting sick, because it's very costly when you are sick. But the problem with prevention is that there's no immediate reward for you for doing the good thing, right? So you eat a salad, you have a choice between eating a salad, getting, I'm going to get the British word wrong, chips. Oh, you get a plate of chips, right? Then they're great here. Which one is more immediately satisfying? The plate of chips, okay? And everything's better when it's fried. I was just at a buffet yesterday and the starter table was full of fried food. So we're not rewarded for it. And I have a blank screen. So why would we start looking at games? And this slide is just about how, and I'm sure a lot of you actually in technology are familiar with this, but there's a huge video game market out there. It's growing faster than movies. It has even surpassed music in terms of its revenues. So it's a very lucrative business. And it's also a very common form of entertainment. So the interactive software Federation did a survey in Europe, and 1 out of 3 Europeans are playing games. And it's not just young boys, it spans the age group. Those young boys got older and they're still playing games, they're still familiar with them. One of the biggest growing markets is women who are playing casual games. So everyone's getting involved in games. And just as an example, so, you know, I'm come from the US, obviously, from my accent. And whenever there used to be a school shooting, they wanted to blame the video games, right? And so they used to say the video games caused the violence. And now, well, they still keep asking that question. But if the kids don't play video games, then they'll say like, well, then he's really weird. He must really not fit in with society because he doesn't play games. So that's a change. And I'm going to talk about serious games, which is basically a video game used for training and education. The main goal is not exclusively entertainment, but it's also learning and education. I like to emphasize the education part because a lot of things called serious games aren't very much fun. And I think that's one of the goals, is to include fun in it, and even experimenting with fantasy, which is something in the medical field a lot of people don't like to do, but we're starting to see you can get good learning outcomes that way. And also I mentioned that I'm a psychologist, and I'm interested in video games because I was trained as a psychologist. I want to help people, I want to help them change their behaviors, and the typical model in psychology is you go see a therapist or a counselor and they talk with you about your problems, and you're supposed to do something. Well, again, just like the medical field, people don't often do that. They're not excited about going to see the therapist. It's very stigmatizing. But if you look at that time, if you looked at young kids, they were spending hours in front of a video game. Very immersed, very engaged. So the question is, how can we use that immersion to do something good with games? And where do gamified approaches fit? This is where I kind of see, I mean, it's not going to answer all questions, but it's when healthcare has reached its limit. So what I was talking about, we create all these technologies, we make all these advanced drugs, but people don't take them, people don't use them. How can we get people engaged in something? So a gamified approach can fit. Where education fails, so where when I tell you to do something, I tell you about your disease, I tell you how it works, I tell you what's going to happen if you don't do the proper thing, you're going to die, your leg is going to fall off, but people still, you know, go out and eat sugar or whatever and don't exercise, so where education fails. And where memos and training exercises fail, yeah, this is more for corporate clients, so all these corporate clients send out a memo, we're changing, it actually might be happening at work, or maybe not even getting a memo, but it's like, we're going to make you aware that the following changes are going to occur, and we want you to embrace the change and go along with it and do this and that differently, and people just throw it out. And I'm going to talk a lot about video games come in when behaviors need to change. So what also I'm going to try to talk about is how we've had a really heavy focus on increasing knowledge, because we have this hard set belief that knowledge changes behavior. And that is true, knowledge does change behavior, but what we're seeing is it's not enough. Okay, and video games can come in when they're designed right, when knowledge fails and you need to change behavior. So I'll talk a little bit about that. I think it's an interesting area. And I will give you a few examples of some video games that I've worked on and some other ones to kind of inspire you and show you what video games can do. Oh, so I'll talk about my game for adolescents with cancer, a game I worked on with Sanofi Pharmaceuticals for older patients with chronic kidney disease, and also a game I worked on recently with attention deficit disorder. We've done randomized control trials with, we did a prospective trial with the phosphorus mission, but with these two we did a randomized control trial. I'll talk about those. Okay, so here's an example of remission. This is a game for adolescents with cancer, so I just want to give you a feel. So you play, it's a third-person shooter. I made a violent video game, also very bloody because it goes on inside the body. But you play Roxy, who's a nanobot. You go inside the body and fight cancers and side effects of young patients with cancer. So this is what it looks like. So she has a sidekick, Smitty, who gives her guidance. She's dealing with a seizure that happens in patients who have brain tumors. She's surfing on throw up, trying to get the patient to take medications to soothe the inside of their GI tract. She's fighting infections. she's working on experimental cancer therapy. It's the final locked mission. And that's Roxy, and here she is shooting a cancer cell. And it's called remission, re-mission. And it was developed by Hope Lab. I co-founded this company in the United States with Pamela, who is the wife of Piero Midyar, who's the founder of eBay. And she had, it was actually her vision, and I worked with her because I'm a psychologist, and helped her get started. But she got her master's in cell biology and was doing research on the slides of cells and looking at the DNA of kids with cancer, and always felt like she wanted to do something more for kids with cancer. Her mother had cancer, and she really felt and saw that just having a fighting spirit, taking an active stance in fighting your cancer was very important. And her husband, Pierre, used to come home after work and play video games to get his frustrations out. And she put that all together and thought, wouldn't it be kind of cool if you made a game where you fought cancer and we could do that for the kids? She approached big video game publishing companies like Electronic Arts. They said, great idea, but there's no market, and we can't make money off of it, and we can't put our resources into something that doesn't make us millions of dollars because it's an opportunity cost. Long story short, eBay went public. They became billionaires overnight, and she made the game herself and asked me to come and join and help her, so I co-founded Hope Lab with her. So I was charged with making sure that the game worked, which I was very happy about because I told her I'm not going to do this unless you actually want to do something that works. I'm not going to give out teddy bears. I'm not going to give them something fun to play to just make them feel good. I actually want to make a difference. So what we did is I got together with some specialists, and one of the things we decided to focus on was adherence to medication. And here's one of the pieces of inspiring evidence. So Archie Blyer is a pediatric oncologist. Look at my time. Okay, it says 33 minutes. So how much time do I have? A minute?
10.
Okay, I'm going really fast. Okay, here's what happened. I apologize to the non-native speakers of English because I'm going to speak really fast. Here's what happened. They looked over the improved survival outcomes when new cancer therapies were introduced over the 70s, and they saw that a nice improvement in survival outcomes for young people, old people, not working for adolescents with cancer. This could have to do with their biology. They have more hormones in their body, they're growing, more chance for mutations in their cells and for cancer to start. But they also knew that adolescents were horrible at doing what they were told. And we all know that. We did that. Our kids do that. So this is Roxy. She's an Nanobot. She goes inside the body, fights cancer. And the main thing that I really wanted to focus on, and the doctors told me was important, was to show the kids that cancer cells divide. I mean, you can tell them that, okay, and to show them what the chemotherapy does and why it's important to fight their cancer. So what was happening with kids with cancer was they would take their oral chemotherapy, they would throw up, their hair would fall out, they would get diarrhea or really bad constipation, their face would blow up so you can't recognize them, they were tired and getting sick all the time and they couldn't hang out with their friends. Okay, so if you say, you know, in 20 years or 10 years you'll live longer if you take this, and you know that when you say that to anyone, especially young kids, they don't care. If you say you have to do your homework on a Friday night, you can't hang out with your friends because you need to go to college, they'd rather hang out with their friends. They're very present focused. What this did was it took them inside the body and they thought about their cancer differently. They saw it as an epic battle. And they could see that when they went inside a lymph node, they killed the cancer cells they were dividing, and they would go into another section. But if they left one cancer cell there, it would reproduce and regrow. So they understood why they had to take their chemotherapy long-term to get every last one of them. And I have to go quick. So we did a randomized controlled trial, 34 hospitals, US, Australia, and Canada. Treatment control group. What happened was, so this is significant, this is the raw data, we did the analyses on the transform data, but the kids basically, we gave them their antibiotic pills because they can often die of infections because chemotherapy kills all rapidly dividing cells, including your immune system cells. So they can often die of infections. They took more of their antibiotics. We also took blood draws from them before they got the game or control game, 1 month later, 3 months later. We sent it to the lab. And so this is kind of interesting. This shows why control groups are important. this is the blood levels of chemotherapy metabolites of kids playing our game, and this is the blood therapy metabolites of the oral chemotherapy in the control group. And what you see in the control group is what happens when people have a chronic illness and a complicated medical regime. They're very adherent at first, and it goes down. Remission came in and had a long-term effect on their adherence behaviors. And these small differences have been shown in other studies related to survival outcomes. Okay, it's published in Pediatrics, High Impact Journal. It's available for download here. It's actually quite an old game, but I still get interviewed for it. Recently did an interview with the Wall Street Journal on why is it still so popular. Very successful. It was acclaimed as one of the examples of the most successful serious games for health. Okay, I did a game for attention deficit disorder. I'll show you. It's all in Dutch, so you can't understand it, so I'm not going to show it to you. But talk to me about it. That's going to be coming out, hopefully. We have the article in submission. And I can't talk about the results, but I can say the researchers were very happy with the outcomes. I also worked on this game with Sanofi. It's actually a casual game, and combined with videos and quizzes to teach patients about how their phosphorus binders work in their body, because they weren't taking their binders correctly. They don't understand about phosphorus in their diet. I'm also submitting that to a conference soon, so I'll be able to talk about that later. But it's had worldwide distribution so far, which I'm quite proud of with my serious games, is that a lot of them kind of die after, you know, European funding ends out. My games have gone out to be distributed. Okay, I'm pushing the wrong button. Oh, I also have a failure game. I'll show you a little bit of this. I'll kind of talk over it a bit. This is a patient safety game.
As a junior doctor, there's a lot you need to
the
learn.
Netherlands.
And a lot of stuff you need to learn the hard way. But some things you would like to be able to learn not the hard way, especially when patients get harmed. It'd be really nice to learn about situations before you're actually having to experience them.
So this was a patient safety training game for young doctors. I made it when I was in the Netherlands. I lived there for 6 years before coming here 7 months ago. So the concept is that you move up from being a junior doctor to the chief medical officer, and you're asked to go on these missions to help take care of patients where the hospitals can't handle the overflow. Yeah, so the doctor's kind of resistant to this fantasy situation, but the young doctors really loved it. And one of the gimmicks that we had was biofeedback in the game to help doctors learn how to relax. Because when I was reading the literature on patient safety,
We are an international team.
I'm just going to talk over it, sorry. When I was reading the literature on patient safety, they would say, oh, this is the background for, this is why mistakes happen. They were saying, like, a lot of mistakes happen because of stress, because people are stressed out. And then that was it. That was the last thing they said about it. They didn't say, here's how you can manage stress, here's how we've looked at it. I'm a psychologist. I knew about a game for biofeedback that helped people do breathing exercises to help them focus and relax. So we incorporated that in this game, along with another focus on other human factors issues such as communication, professionalism, teamwork, and leadership. And we had a bunch of patient safety leaders come and give talks in this game. And I call it my failure because I made it about 4 years ago, and it's still sitting on a doctor's desk because the doctor thought that even though he didn't have a background in serious games or business and marketing, that he could handle the marketing. Okay. So I don't know what the lesson is there, but you can probably figure it out. Oh wait, are you taking? Okay. Yeah, and it also won a lot of awards. It won an award at the biggest simulation conference in the world, in the U.S., and also at the Serious Play Conference. So, there's also a game. I worked at this company, but I actually didn't work directly on this game. For surgical training, laparoscopic tools are very non-intuitive. for people to learn how to use. So what they did was they just made a game in kind of a world that looked like the inside of your body. Shadows are weird, but you had to do these same kind of actions in a fantasy world, in a game environment, that you have to do with your laparoscopic tools. And they've done outcomes research and found that it's correlated. It does increase their efficiency in doing surgeries. And it's also correlated with other trainers in laparoscopic skills. This is a great game to know about. I also wasn't involved with it, but I have high respect for it. Basically, it was a game kind of involving cognitive behavioral therapy for people who are depressed. It got published in the British Medical Journal. And basically, they found that this video game intervention was as effective as traditional therapy in reducing depressive symptoms and the response rates, but they also had a higher remission rate with depressive symptoms. So more people playing the game had complete remission of their depressive symptoms than people who had traditional therapy. It's great, it's non-stigmatizing, you can do it at home, you can do it as an adjunct to therapy. I think this shows a new path. Okay, now here's what you all came for, I think. But I kind of talked about this. Some of my messages, you can't think like SpongeBob that if you provide information in a game, it'll magically change behavior. So every time you start getting tempted to use text to impart information, not visually, stop and ask yourself if there's any way to do it visually. And focus on behaviors over knowledge. Do your homework. People ask me, why was your game so successful? I do tons of homework. I make sure I'm focusing on a huge problem that I can have an impact on, not on one that everyone says needs to be addressed. Like people are telling me, you should address depression in kids with cancer. When I looked at the data, they actually weren't that depressed. They got so much support during the cancer. It's not finding, but I'm not going to focus on something that doesn't need to be changed. And I would also say, be brave. Focus on the toughest problem in your area. Okay, because video games are kind of amazing. You'll be surprised. And also health behaviors in games. Find clever ways to measure behaviors. I say this because video games have an impact on behaviors. We're really used to asking people to self-report what they do. In my remission game, all the kids said they were taking all their medications as directed over the course of the study at 96%. I've never seen such a high P level. It was like 0.95, 0.99, okay? And they're just amazing. Their pill bottles and their blood samples were telling me something different, and I trust them more. What you have to do with video games is be kind of creative about how you assess those behaviors. And also just be careful too with wearable technologies. You will get a ton of data. Everyone gets so excited, I'm getting so much data. Know exactly what you want before you go in there, because that data is a mess. And if you think, I'm just going to look for something I can find in a big mess of data, you might find something that's not important. Okay, so know exactly what you want from the beginning, and that goes back to do your homework. And also clever ways to measure behavior. I will just say this about wearable technologies. Everyone's focusing. I have 1 minute. Okay, everyone's focusing on them, but people don't want to wear them because they're kind of geeky. It makes you look like a total geek. I mean, I'm sorry, but even Google Glasses, I mean, they are cool, but if you walked in here, no one's wearing Google Glasses. You'd be like, what a nerd. Or you have to wear these big, bulky outfits that are tracking your heart rate and your stress and your movement, all this stuff. But I think that's where collaboration with art and design is going to help. We need to collaborate, so I'm talking to all these technical people. It's great you design the technologies, but people have to use them. So please collaborate with usability experts, with psychologists who know about how people feel and how they can measure behaviors, and you'll be happy to know, here's my summary. Focus on behaviors, do your homework, find clever ways to measure behaviors. I can talk more. And my conclusions, and since I have 1 minute, I'm going to be good, so the next speaker doesn't get mad at me. Here's how you can contact me if you have more questions. I'm at the Serious Games Institute. I have a blog, and you can please follow me on Twitter. But I'd be happy to talk with you if you're interested in what we do or have an interesting project, interested in collaborating. So thank you.